Hello, my name is Caleb Lee, and I will be presenting on intergenerational trauma for our diversity research presentation. Also, in our group is Christine Petty and Luis Velasco. So just table of contents. First is intergenerational trauma. Second, desired outcomes. Third, current approaches. Four, necessary steps. Fifth, anticipated resistance. And sixth, advocacy. So intergenerational trauma, just identifying what that is. Intergenerational trauma is the transmission of trauma or its legacy in the form of a psychological consequence of an injury or attack, poverty, and so forth, from the generation experiencing the trauma to subsequent generations. And this definition comes from the APA. And describing further intergenerational trauma is the transference of this effect is epigenetic. The trauma experienced by the older generation is translated into a genetic adaptation that can be passed on to successive generations. The trauma reactions vary by generation, but often include shame, increased anxiety and guilt, a heightened sense of vulnerability and helplessness, low self-esteem, depression, substance abuse, disassociation, difficulty with relationships and attachment to others, and extreme reactivity to stress. Desired outcomes is it typically includes and focuses on healing, resilience, and breaking the cycle of trauma transmission. So first is awareness. So helping individuals recognize and understand the origins of their trauma. Second, healing and building resilience, recognizing and understanding the origins of their, or providing therapeutic interventions rather, that promote emotional recovery as well as coping strategies to manage the effects of trauma. Third, breaking the cycle. Prevent the transmission of trauma to future generations through emotional well-being and healthier family dynamics. Fourth, reconnecting with culture and community. So reconnection with cultural roots and traditions to grow a sense of identity, community, and support, to strengthen social support networks, and to provide an environment for healing. So I'm going to be addressing three different current approaches to intergenerational trauma. And the first is multifamily therapy. Multifamily therapy seeks to address the intergenerational trauma due to effects of parental trauma leading to psychosocial disorders. Multifamily therapy aims to restrict the relational consequences of parental trauma and strengthen family resilience through enhanced sensitive parenting and a secure attachment style. In relation to multiculturalism, within the context of a safe multicultural group setting, multiple perspectives and varying cultural backgrounds can support each other in the communal discovery of how to become competent parents despite their past traumatic experiences. A critique is that in order to be efficient, the collective members of the group and their backgrounds, all their commonalities and contrasts need to attribute to increasing a sense of safety and trust, which seems more unlikely than likely. The second current approach is an internal family systems therapy approach. So this focus is on the self through the discovery that there were connections that his clients made between external family systems and internal self-talk. The four strategies for this treatment are the use of cultural informed treatment, interruption of unhealthy family communication patterns, giving trauma a voice within the family, and helping parents offer children the permission to dissociate. A critique in relation to diversity is that according to the cultural background, a strategy such as giving trauma a voice within the family may not be culturally appropriate and quickly dismissed. The strategies appear to be limited in scope to immigrant families, whereas it may be more effective to Western and nuclear families. The last approach is a psychoeducational group interventions approach. Dr. Braveheart's treatment approach is grounded in traditional healing methods and ceremonial practices of community. More specifically, the treatment approach is through a psychoeducational group, interventions delivered at geographic locations that are sacred to members of tribal communities that involves ceremonies reinforcing cultural identity. In relation to diversity, this approach seems to be more intentionally catered to a specific cultural background, such as indigenous people groups, whereas previous methods seek individuals and families to fit an abstract expectation that has no cultural relation to the client. A critique of this approach would be that in terms of diversity, this method is not replicable across most cultural contexts outside of tribal or spiritual communities. Next, I'll be passing it on to the next person.
Necessary steps. The necessary proactive steps and alternatives to affect awareness, healing, and cycle breaking in the context of intergenerational trauma are multifaceted. The first step being to conduct a needs assessment in the local community. There are several methods that the counselor may use to accomplish this objective. The counselor may gather data through community surveys, focus groups, and interviews to more fully understand community cultural need. These needs assessments will inform culturally competent and tailored programs that effectively address the needs of the targeted community. The counselor should seek to build partnerships and community resources. Methods counselors may utilize could be to collaborate within the local counseling and mental health professional communities and local organizations such as schools, churches, advocacy, and other community organizations, or even local medical offices. The counselor could work to distribute educational materials throughout the community, educating both on groups and resources. It is important that the counselor utilizes both their professional network and information learned from their needs assessment to deploy educational resources in such a way that they actually reach the community they are meant to serve. For example, perhaps a flyer or announcement at a local place of worship would be more effective than a social media post, or the opposite. Regardless of what the education looks like, it's important that it conveys that these resources are both meant for you and accessible to you, you being the intended audience. An additional step the counselor would take would be to implement accessible community programs. The emphasis here being on accessible. For example, if there are counseling opportunities being presented to the community on an individual and family level, do these counselors actually have space in their schedule or take the insurance most widely used by that community? If community events are being implemented, has grant funding or other community resources been identified and utilized so that these support structures can take place without additional stress and burden to the community which is meant to be served? If there's an intent for community-led groups, are they being given the necessary training and supporting structures to implement? And finally, advocacy is an essential step, which will be discussed further a couple slides from now. Now for anticipated resistance that a counselor may face when working to address and heal intergenerational trauma. One is stigma. There may be stigma towards seeking mental health help. The stigma can exist at many levels: individual, immediate, family, friends, extended family, cultural, or community. And that leads into the fact that some cultures believe that trauma or issues in general should be resolved within the family unit and do not believe one should go outside of the family to seek help and resolution. In addition, when developing the community resources and programs, if the counselor didn't consider techniques that would be most effective for the targeted community, the resources being provided simply may not resonate with the intended audience. So from there, lack of trust is another potential area of resistance. So how has the community been treated in the past? How have community plans been implemented, and have they been implemented in a culturally competent way? Has there been overshadowing going on? Has there been bias? And have the helpers been biased in ways that don't just hinder positive outcomes, but negatively affect individuals in the community before? And then we have systemic barriers. One thing I spoke of earlier was insurance. If counseling services are being offered that would normally be billed to insurance, are these accessible to the members which are meant to be reached? For example, Medicare and Medicaid. Are the billing offices, conducting their business appropriately and billing correctly so as not to place further burden on the recipients? Are community resources being held in an accessible location? One, reachable by public transport or meaningful and convenient to the targeted community? And finally, advocacy. One essential piece of advocacy is to address systemic barriers and become an ally to the community at hand. As stated earlier, apply for funding, advocate within the local health community, communicate with your legislators, local and beyond. An issue can't be addressed until people are willing to talk about it. Education and collaboration. Community events, educational resources, as mentioned, are powerful tools, and the more community organizations that are on board with the fact that intergenerational trauma is both an issue worth fixing and an issue that needs fixing will help ensure these effective positive outcomes are achieved. Local community-based peer-led support groups are so important. And one way to advocate for others is to compassionately and ethically give them the tools to help them advocate for themselves. And this is more than, maybe the phrase, you are your own best advocate, because that phrase can be both empowering, but disempowering and marginalizing at the same time, depending on the context within which it is used. So are you truly partnering with the community and helping them access resources to implement empowered advocacy?
Hi all. Next we're going to look at implications of intergenerational trauma on counseling, starting with school counseling. First, I have trauma-informed education. School counselors can advocate for their schools to adopt trauma-informed practices that recognize and address the impact of trauma on students' learning and behavior. This includes training teachers to understand and be aware of trauma-related behaviors in order to create supportive environments. Next is a curriculum integration by developing curricula that include the history and experiences of diverse populations. Schools can promote understanding and empathy. This can help mitigate the effects of intergenerational trauma by fostering a sense of belonging and identity among students. Finally, we have support services. School counselors can help implement school-based mental health services and counseling programs that are culturally sensitive and accessible. Schools can also partner with community organizations to provide additional support and resources. And for family counseling implications, uh, education and awareness. Marriage and family counselors can provide educational programs for families about the impact of intergenerational trauma and strategies for healing. This can include workshops or family counseling sessions that focus on improving communication, addressing trauma-related issues. Next is culturally cognizant family counseling. Offering family therapy that incorporates cultural values and practices can help to strengthen family bonds and address intergenerational patterns of trauma. Finally, is support networks. Creating or strengthening community support networks can provide families with resources and a sense of community. This could involve peer support groups or community events focused on healing and cultural continuity. Lastly, we have for clinical mental health counseling. The first implication is to ensure that mental health professionals are trained in cultural competence and are familiar with the specific historical and cultural context of their clients. This includes understanding the impact of historical trauma and using culturally appropriate interventions. Next is trauma-informed care. Using a trauma-informed approach that recognizes the prevalence of trauma and its impact on individuals would be essential in the treatment of intergenerational trauma. This type of approach emphasizes safety, trustworthiness, and empowerment in the therapeutic relationship. And final implication is the integration of traditional practices. Collaborating with clients to incorporate traditional healing practices and cultural rituals into the therapeutic process, when appropriate, can enhance the relevance and effectiveness of therapy. And next, I'm going to talk about awareness of some historical trauma among different demographics. Counselor awareness of historical traumas like slavery, segregation, and mass incarceration is crucial for understanding the profound intergenerational effects these experiences have on African American clients. This insight enables counselors to approach treatment with a deep appreciation of the systemic and historical factors contributing to clients' current struggles. By integrating this historical context into therapy, counselors can offer more effective support that addresses both individual and collective wounds, fostering healing and resilience. Counselor awareness of historical traumas like Japanese American internment, Vietnam War, and Cambodian genocide is essential for understanding the complex intergenerational trauma faced by Asian American clients, as these events have deeply influenced their familial and cultural experiences. This knowledge enables counselors to address the unique psychological and emotional impacts of these historical traumas, including loss, displacement, and identity struggles. By incorporating this historical context into treatment, counselors can provide more compassionate and effective support, fostering resilience and healing within these communities. Counselor awareness of the Holocaust is vital for understanding the profound intergenerational trauma experienced by Jewish American clients, as it provides context for the pervasive impact of historical loss, persecution, and displacement. And this understanding helps counselors address the specific emotional and psychological legacies that may be present in their clients' lives, such as anxiety and identity struggles. By acknowledging and integrating this historical trauma into treatment, counselors can offer more nuanced and empathetic support, fostering a deeper sense of connection and healing. Counselor awareness of colonization, forced assimilation, and land seizures is crucial for understanding the intergenerational trauma experienced by Native American clients, as these historical injustices have deeply affected their cultural identity, family structures, and community cohesion. This awareness allows counselors to approach treatment with sensitivity to the unique historical and systemic factors that contribute to their client's trauma. By incorporating this context into therapy, counselors can better support healing and resilience, addressing both the personal and collective impacts of these historical traumas.